Modern psychiatry remains trapped in symptom-based diagnostic frameworks established in the 19th century. Current psychological evaluations face diagnostic inaccuracies, with the NIH reporting 46 to 60% accuracy rates for anxiety and mood disorders due to overlapping symptom profiles, leading to 43% of bipolar patients receiving initial misdiagnoses. They face temporal delays, with an average of 11th-month diagnostic odysseys for complex psychiatric cases, exacerbated by disease progression and healthcare costs. They face subjectivity gap, with DSM-5 criteria reliance on patient self-reporting, introducing a 34% interclinicial diagnostic variance. And they face a biomarker void, where unlike other medical specialties, psychiatry lacks FDA-cleared objective diagnostic tools, forcing 78% of treatment decisions into trial and error approaches. This diagnostic crisis fuels $210 billion in annual global cost from ineffective treatments and hospital readmissions. PsycheMAP directly addresses these challenges through quantifiable neurosignatures extracted from 5-minute EEG recordings. Our hybrid deep learning architecture solves psychiatry's diagnostic limitations through 3 technological breakthroughs. The first breakthrough is an adaptive neural decoding engine, comprised of a CNN bi-LSTM model which processes spatial temporal EEG patterns through 8 convolutional layers in a bidirectional LSTM cell. This neural engine also has wavelet denoising plus dynamic baseline correction, which enables reliable feature extraction across diverse EEG hardware. This results in over 96% accuracy, significantly outperforming traditional clinical assessments. And with a real-time processing of just 97 milliseconds, this integrates seamlessly with clinical workflows. The second breakthrough is an interpretable diagnostic framework. Through SHAP-based feature attribution, we are able to map alpha and gamma band coherence to specific DSM-5 criteria, fostering clinician trust and understanding. This framework also gives us a topographical visualization of neural network activation patterns alongside graph theoretical analysis of functional connectivity biomarkers. The third breakthrough is a scalable deployment architecture. PsycheMAP provides a cloud-based SaaS platform with HIPAA-compliant AWS infrastructure, API integration for major EHR systems such as Epic and Cerner, and edge computing compatibility for low-resource settings. PsycheMAP's implementation will generate measurable clinical, economic, and health equity benefits, with the clinical impact being a 58% reduction in psychiatric misdiagnosis within 5 years, 22% faster treatment initiation through rapid EEG-based screening, and a 41% decrease in polypharmacy rates via precise diagnostic stratification. The economic impact includes an average saving of $18,400 per patient through reduced diagnostic testing, a $2.9 billion annual U.S. healthcare cost reduction from accurate first-line diagnoses, and a 23% improvement in workforce productivity through early intervention. The health equity benefits are portable diagnostic capability for rural and underserved populations, language and cultural agnostic biomarker analysis, and a 79% cost reduction compared to fMRI-based approaches. The demand is great. The red ocean of current psychiatry drowns in subjectivity and diagnostic errors, while PsycheMAP creates an uncharted diagnostic blue ocean through neural biomarkers invisible to human observation. Our first-tier non-customers are the 240 million undiagnosed individuals avoiding traditional psychiatry due to stigma. Our second-tier non-customers are the 410 million misdiagnosed patients cycling through ineffective treatments, and our third-tier non-customers are the 320 million in developing nations lacking psychiatric specialists. We have a 3-step revenue architecture. The first step being a SaaS licensing with an annual per-clinic subscription of $18,000. The second step being a pay-per-diagnosis with an affordable $85 per EEG analysis cost through telehealth's APIs. And the third step being data insights, generating $220,000 through annual predictive analytics contracts. To scale PsycheMAP, we have created 3 phases. The regulatory phase between 2025 and 2026, where we will go through FDA de novo submission and CLA certification for diagnostic use. Second phase being pilot deployment in 2026, with a 12-clinic trial with Johns Hopkins Psychiatry and integration with Epic EHR system, and national scale in 2027 to 2028 with partnerships with GEL Healthcare for hardware bundling and Medicare Medicaid reimbursement approvals.